welcome back. While some health experts think the government's COVID-19 vaccination targets are over-optimistic, President Cyril Ramaphosa says 40 million people should have received their jab by December. We'll now get more analysis on this from Professor Barry Schoub, Virology Expert and Chairman of the Ministerial Advisory Committee on COVID-19 vaccines. Thanks so much for your time. Prof, I think we are on 16.7 million people at the moment. The daily target was to have over 300,000 people vaccinated per day. Will we meet this target of 40 million by December, do you think?
I hope so. I really hope so. At the moment it's slipping. The last 24 hours we had, 181,000, quite way short of the 300,000 target. So unless things change quite markedly, which of course they can do, and we hope they will do, they need to kind of basically get more vaccination sites out there, and we need to kind of also communicate more to the population to kind of overcome this apathy. And if that can be done, and if it will be done, if it's done successfully, then we could reach that target. I hope we will reach that target. I think we need to.
Speak to us about why you think we are not vaccinating over 300,000 people per day. It's got a lot to do with hesitancy, and a lot of people are also saying that it could be due to the fact that we don't have as many Johnson & Johnson vaccines in the country. What do you think is contributing to our low vaccine rollout turnout?
Yeah, Heidi, I think it's really two things. I think one of it is a bit of apathy. People need to kind of be motivated to get, and also not having the availability of transport, so to get to the vaccination sites. So to overcome that, we need to take the vaccination sites to as much of the population as we can, either with mobile vaccination sites or taking it to industry, taking it to workplaces, that kind of thing. That's the one thing, the apathy. I think there's also, but probably even more, a larger proportion is vaccine hesitancy. There is unfortunately still a large chunk of the population that don't feel confident, don't feel reassured with the vaccine. And I think there it's a problem with communication. We need to have what has been called trusted communicators, people who are part of the community, who can speak the same cultural and physical language as all citizens in the country, and get out there and basically give the message that vaccines are safe and they're highly effective. And that's really the only way that we can overcome this dreadful epidemic.
Do you think incentivizing those who get the vaccine is an option at this stage?
Yeah, well, this is what's been internationally debated. Is it the carrot or is it the stick? Or is it the combination of it? The stick being that if you don't vaccinate it, then there are certain things that you forfeit in terms of certain work privilege. You won't be able to work in certain situations where vaccination is so important. Or incentivization, that there are various incentives in terms of, for example, medical aid benefits or other benefits. In some countries, there are even cash benefits, or in lieu of cash, other material benefits. I'm not sure that's the right way, but it certainly has been looked at in many countries overseas. So we do need to have a look at I suppose, incentives and disincentives, the carrot and the stick. But we do need to get people to kind of come and be vaccinated, and we do need to reassure people about the vaccine.
While we have not met our targets and we still need to vaccinate a very large number of the population, is South Africa considering booster shots, especially for those that took the Johnson & Johnson jab?
Heidi, look, in certain limited, restricted situations, booster shots should be contemplated. For example, people whose immune systems are suppressed, immunosuppressed individuals, they would certainly benefit from a booster shot. People that are in high-risk situations like healthcare workers could benefit from a booster shot. However, there's no hard evidence that booster shots are urgently needed. There's no hard scientific evidence of that. Obviously, a booster shot would kick up the immunity, and in certain situations that would be, as I said before, if the immunity is suppressed or if people are in a high-risk type situations. But I still think our main emphasis, our main priority must be to get as many people getting at least some vaccination in their arms.
Great. Thanks so much for your time and insights, and hopefully we meet that target of 40 million by December. That was Professor Barry Schoub, virology expert and chairman of the Ministerial Advisory Committee on COVID-19 vaccines.